If you have diarrhea, you will typically experience loose, watery stools multiple times a day. And in some serious cases, it is also necessary to see a doctor. However, do you know what's diarrhea? Diarrhea is the condition of having at least 3 loose, liquid, or watery bowel movements each day. Diarrhea is also divided into infectious diarrhea and non-infectious diarrhea. When you have diarrhea, you may experience all of these symptoms, or only a few. The main symptom of diarrhea is loose or watery stool that leads to dehydration, vomiting, severe pain, fever, and so on. Actually, every year, almost 1.6 million people died from diarrhea diseases globally. From the figure, we can clearly see the proportion of deaths in different age groups. 1/3 were children under 5 years old. And nearly 40% were people aged 70 and over. In addition, infectious diarrhea accounts for 60% to 90% of diarrhea cases in different regions. The study found that there are 3 causes that lead to infectious diarrhea, namely virus, bacteria, parasite. Among them, the virus factor accounts for 50%. Among the many viruses that cause infectious diarrhea, Rotavirus, Adenovirus, and Norovirus rank the top 3. From the graph below, we can clearly see the proportion of cases caused by these 3 viruses in different age groups. In the case of children under 5 years old, rotavirus is the single largest causative agent, 27%, followed by adenovirus 11%, norovirus 2%. In addition to single virus infection, mixed virus infection is also common in clinical practice. Diarrhea caused by co-infection with more than one virus reached 14.5%. So, how to diagnose acute diarrhea? In clinical diagnosis and treatment, the most important method is the combined use of these 3 steps. Ask medical history. Identify stool character. Carry out stool tests. Your doctor may order tests to determine what's causing your diarrhea. Possible tests include stool pathogen test, blood test, flexible sigmoidoscopy. Stool pathogen test is helpful to conduct early triage and rapid management. There are mainly 3 test methods: stool culture, stool panel, qPCR, stool antigen test. For stool culture test, it's the clinical gold standard. However, it requires a long time and not suitable for early diagnosis. Besides, it's easy to be contaminated. For stool panel, qPCR, it's the early diagnosis, has high sensitivity and high specificity, but it requires high laboratory conditions and needs special equipment. For stool antigen test, it's the direct evidence of infection. Convenient and quick, take less time. High sensitivity and specificity. Through the stool antigen test, early diagnosis and rapid management of infectious diarrhea can be achieved, and the virus can be prevented from spreading in the community and hospitals in the shortest time. Next, let's introduce a new product. Innovita Rapid Test, Rotavirus, Adenovirus, Norovirus Antigen Test Kit. This kit is a rapid and effective method for diagnosing 3 common viruses. It has obtained NMPA and CE approval. Each test gets the result in 15 minutes. Overall, this product has great advantages over others. Sampling is non-invasive and convenient. 3-in-1 combo test detects 3 virus at the same time. No instruments required, get results in 15 minutes. If you need more information, please contact us.